Welcome to Fascia Masters Q&A with D&Q, episode 11. How does block therapy benefit arthritis?
Hi there, my name is Deanna Hansen. I'm a certified athletic therapist and the founder of Fluid Isometrics and Block Therapy.
And my name is Quinn Castelline. I'm the VP of Block Therapy and the lead block therapist.
So specifically with arthritis, today we're going to be discussing osteoarthritis. So ultimately that's the mechanical wear and tear that happens in the joints, breaking down the cartilage, creating inflammation, and then ultimately when the cartilage has worn, that's ultimately arthritis.
Right.
So anytime we have itis at the end of the word, it means inflammation of. Arthra is the capsule, the joints, so the cartilage. So basically, it starts as an inflammation in the joints, and then if not addressed properly, it wears down, and then it can create really big problems and pain to the point where people sometimes need joint replacements.
Yeah.
So ultimately, what is it that starts this process, and what can we do to prevent it?
Great question.
Thank you. So this takes us back to our discussion on proper postural alignment, cellular alignment. So again, I don't know how they know this, but they say that we have approximately 100 trillion cells. And every cell in the body has its place that it's supposed to be. And providing every cell is where it's supposed to be, they are properly fed and clean, they're doing their job, and there's no issue. But the challenge is, in order for that to happen, we need to do two things.
Right.
What are they?
Breathing and posture.
Yes. So conscious breathing feeds the cells, and when we breathe diaphragmatically, we feed the body 600% more oxygen. But we also need to understand proper foundational alignment so that we can support our structure and keep our cells, our joints, our skeletal system, everything exactly where it's supposed to be.
Right.
So why aren't we able to just simply do this all the time? And it's because gravity is constantly pulling us down toward the earth. Gravity combined with unconscious posture and unconscious breathing creates a winding down over time. Typically we get shorter and wider as we age. So when we get shorter and wider, it's because we're compressing. We're literally falling into the internal space in the body. And that space can be affecting directly the cells, but it can also be affecting the joint space. So let's just think about the knee joint, for example. You know, for the knee to be able to extend and flex and go through the motions it needs to, it has its alignment so that we can do this. But what happens if we shift our posture as we tend to? Typically, if we're right-handed, we shift over to the left side to keep that right side free for action, but that creates a winding, a shifting, and a collapsing of the joint space itself. And if you look at most people stand hyperextended at the knees. So now they're not even using their muscles to support the weight of their body. They're taking that joint space away, and now they're forcing the cartilage from one bone to the other to connect and wear. So again, initially, inflammation is the result because the body is saying, hey, you're breaking me down. And in our injury topic, we discussed how with stress, the body sends inflammation to rebuild tissue. But if we don't actually change the way that we're standing and create proper alignment, we're going to continue to wear it down. So the worst thing people can do is take anti-inflammatories. Because, you know, now if you're an athlete, but you haven't adhered to proper alignment and you've worn that cartilage down, but you still want to run that marathon, what are you going to do?
Well, exactly.
And so, you know, something like Advil, it stops inflammation. And in that moment, you won't feel the pain, but that's not stopping the wearing down of that cartilage. So when you're on the other side of that drug wearing off, now it's going to be that much worse.
Exactly.
And you're just going to keep wearing. So we need to understand proper alignment will keep our cells, our joints in that correct space so that that blood and oxygen can freely flow there. And we have dealt with people that have been scheduled for knee replacements, for example, and through the process of doing block therapy, we have stopped them from needing that surgery.
Yes.
So that's the really cool thing. The body is so incredibly capable at regenerating itself when we give it what it needs. And ultimately what it needs is flow. But for that to happen, there needs to be space, space in the body. So we decompress the tissue. Well, there's 3 parts to block therapy.
Yes.
Share that.
So the 3 parts, first one is creating the space by actually using the block buddy. The second one is now we need to inflate that space with oxygen. So we instruct proper diaphragmatic breathing. And as you mentioned, we can pull in up to 600% more, which is a significant amount of absorption. The third one is now that we've created the space, the oxygenation, we need to own and maintain that new alignment that we've created. So it's the postural component.
Exactly. And it doesn't matter what joint we're dealing with. Every cell has its place. And it's not like we're going to go from 0 to 100 overnight. We're not just going to suddenly start doing block therapy and poof, everything is exactly where it's supposed to be. But it's getting on that path.
Right.
It's understanding that we can let gravity continue to drive us away from alignment, or we can choose to, from wherever we're starting from, move our body back toward proper alignment.
Yeah, and everybody's tweaked and pulled into their own unique way. So it's about understanding your body, becoming conscious of your posture, looking at yourself in the mirror, assessing yourself, looking where you're collapsing, what's causing the knee or the ankle to have that stress and cause the inflammation called arthritis. So a lot of the times, even when I'm dealing with a client who has severe arthritis in, let's say, the ankle joint, I'm not going to go directly to the ankle joint either, because understanding the fascia system, that's not the cause necessarily of that issue. So again, we always start with the breath. We're making sure the body is being oxygenated. We open up the gates of flow throughout the hip flexors, the femoral triangle. We get the knee joints articulating properly. And even just doing that without working the ankle, a lot of people will notice a significant difference in change without actually touching the ankle joint.
And now you just shared with me an experience you had last week that was so beautiful for you. Without going into too much detail, just share that.
Well, honestly, kind of what I've been explaining is similar to that. I did exactly that. I opened up the hip flexor, the knee. I didn't even work really around the ankle until the very end. And now if you've been, for example, limping on that foot because it's that severe, or you need crutches because you can't even apply pressure on it, seeing somebody walk in limping and then being able to walk out without limping is phenomenal. And that's literally within an hour, hour and a half process. So once we've released a lot of the compression, improved the flow, carrying out that old inflammation, bringing in the new to rebuild it, oxygenating, then we need to show the client, show yourself how to assess your body and understand what you need to do posturally for that person. So if you have too much of a buildup on the lateral calf that's torquing and collapsing the arch, we need to first of all, release that, but bring awareness to the arch to lift that arch so that you're actually walking with the foot properly on how it's supposed to articulate and move, rather than being unconscious while walking.
And that's really what our member site is all about. We have 3 21-day programs. Each one of them targets, we've one for the lower body, one for the core, one for the head and neck. And it's over 21 days because it's not a simple thing to just say, okay, I need to align my body so that every one of my 100 trillion cells can be where they're supposed to be. It's a process. And it's a process first of releasing the fascia that's holding us out of alignment, inflating that with breath, and then creating a postural shift with awareness. So in our member site, we basically put everything together so you have everything you need. As well, we can do assessments simply to guide you specifically. So, when we're talking, it sounds like, oh my gosh, that sounds like a lot of work. Actually, it's really not. The work is simple the way it's laid out. It really requires no skill, just a desire to change. And if you have that desire and you're willing to put in a little bit of time, and again, like, we're literally lying on this block. It's not like we're asking you to go out and run or lift weights. We are asking you to lie down and fold your body over the block. And, of course, there's education with breath and how to find the pain and how to move properly on this block, but even literally lying on it will make a difference.
100%.
But then it's also about understanding those foundational pieces, so we don't continue to fall into a slump and then create incorrect alignment in the whole body. So again, it's not an overwhelming process when you dive in, especially the way our member site is designed. We've created very simple to do programs so that everybody can understand what they need in their own body to create the decompression, the feeding of oxygen and blood flow, and again, that realignment. And when we do that, we move away from that cartilage wearing down, we move away from that inflammatory process, and we get back to being able to have full range of motion and freedom in our body. And that's really the goal. When it comes down to physical movement, we want freedom. We don't want to be restricted or inhibited anywhere. Like that baby, you can take that baby's leg and throw it right behind its head because there's nothing restricting that joint. So ultimately, again, like what happens from when we're first born to when we're 20 and 40 and 60 and 80, gravity. Gravity's pulling us down. But the cool thing is we have an anti-gravity design, and that's that full conscious exhalation. And then the block to undo that grip, that 2,000 pound per square inch force of hooking the fascia onto the bone. So again, we have a system that really works. It's really simple, and we're here for you. So we would love for you to reach out to us anytime if you have any questions. You can fill out a free health strategy session, and I would be the one personally contacting you. And we're just here to make your lives better.
Totally. And one thing for you to start right now is if you have arthritis and it's very intense and painful, you may be icing that area as well to reduce the inflammation. We just did a Fascia Masters episode on injury. I believe that was 2 of them before. I'll link that right up here. So that's the first thing you need to start, is don't apply the ice. Second thing you need to start without actually having a block is to understand the posture. And what you can do for free is visit unblockyourbody.com, and you're gonna just quickly, you'll see an ebook and then a 20-minute postural video for the full body. So again, if your arthritis is in your knee or your wrist or your shoulder, wherever it is, this is going to help you along the way. So again, that's unblockyourbody.com. I'll place that right here. And other than that, thank you guys so much for watching this Fascia Masters episode. That's everything, Deanna?
Yeah.
Awesome. So again, if you guys want to ask us any questions, please use the hashtag AskBlockTherapy. You can submit them on our Block Therapy website or email us info@fluidisometrics.com. Until then, we'll see you guys next week.
Breathe and believe.